this?
It is an inability of the body to keep blood sugars where they need to be.
What is the difference between type 1 and type 2? Is it genetic?
Type 1 diabetes is a total loss of beta cell function, which is where your insulin is produced. Typically diagnosed early on. It is not lifestyle related, not thought to be lifestyle related. There is something that causes the body to attack the beta cells, and basically you lose all of your beta cell function. Type 2 diabetes, there's a genetic predisposition typically. With type 2 diabetes, it's about trying to prevent. Lifestyle does have an impact. Your genetics really do have an impact though, but we can delay hopefully prevent the onset of type 2 diabetes with our lifestyle choices. Hypoglycemia, low blood sugars. Typically you feel shaky, sweaty, clammy. That said, people experience them differently. But typically most people are going to feel the shaky, sweaty, clammy, feel like they waited too long to eat, a little nervous, irritable. Those are all signs and symptoms of lows, and critical to treat those and bring them back up in the target range. Highs. With elevated blood sugars, the longer and the higher the blood sugar is, your blood should be very thin. It should flow very freely. But when it's full of sugar and you're running those elevated blood sugars and really high blood sugars, your blood is very thick. It's very sludgy. So motor oil, Caro syrup. And that is, your body responds to that and it starts to pull all the fluid it can and dumps it into the kidneys, and it flushes that sugar, trying to get rid of that sugar through the kidneys. So you have increased urination, you have increased thirst, you have blurred vision, you have fatigue. All of those are signs and symptoms of running elevated blood sugars.
What is a brittle diabetic?
Brittle diabetics are diabetics who are very difficult and unpredictably high, low. We don't know why, what causes it, and it affects their quality of life. You get DKA, you get diabetic ketoacidosis, and it really affects the quality of life.
What is glucose and how does it affect the body when it is too high or too low?
Glucose is that component that our cells use for energy. It's like gasoline in your car. It's how the cells do their jobs. We get glucose from our diet. Our liver makes glucose, so both of those can affect your blood sugars. Blood sugars are affected by stress levels. They're affected by different things, but your body uses the sugar for energy that it gets from the food that we take in. The key here again is prevention. If you have a family history of type 2 diabetes, it is absolutely critical early on, especially those parents and grandparents who are dealing with it, to get kids on board with what do we need to do to be preventing the onset of this type 2 diabetes. If not preventing it, then at least delaying it so that we have less time that we're dealing with long-term complications. So if you have that genetic predisposition, it's key to prevention is the key. That said, we can look at pre-diabetes and hopefully again delay the onset of type 2 diabetes. So if we can look at people who are in the pre-diabetic stage, if they will change their lifestyle, change diet, change physical activity levels, increase their physical activity levels, we can prevent, and research shows that you can prevent the onset of type 2 diabetes 58%. So it has an impact early on. After the onset, it's harder. Diet and exercise may not work.
Why do you check ACL numbers, and what happens if it is too high or too low?
Those numbers are critical in moving forward with treatment. They will let us know where they are over the last couple of 3 months as far as where their blood sugar levels have been. And if the A1C is high, then we want to look at why. Why is it getting higher? One of the hallmarks of type 2 diabetes is that it progresses. I think that some people don't realize that as we age, our beta cell function is declining, and so we have to stay on top of that. So your A1C can kind of let us know where they are 2 or 3 times a year so that doctors can make plans on changing and altering treatments. Type 1, they do a lot of research, but there is no answer to that right now. Type 2 diabetes, again, it gets back to knowing your family history, knowing who has diabetes in your family. Lifestyle choices are going to have an impact, and really starting early on. so that we're preventing.
What are some treatments for diabetes?
Diet and exercise, as you said, that would be obviously everyone's first choice. We don't want to take medications or insulin. However, sometimes we need help keeping those sugars where they need to be. So there are lots of oral medications that we can use to help control sugars. There are insulin injections, and there are other injectables that we can use to help control. The long-term complications of diabetes can be very devastating, and your eyes, your kidneys, your hands, your feet, your heart, your GI tract, everything is affected because you have that elevated glucose level that's circulating through those organs, and they don't function well in that environment. So you're going to have long-term complications if they go uncontrolled for long periods.
Is there a cure that is currently being worked on?
They're always doing new research, different kinds of research for type 2 diabetes and type 1 diabetes. The medications that come out are hard to keep up with. But as far as an actual cure, there's nothing out there right now. They do beta cell transplants. That is always something being worked on. The American Diabetes Association is always trying to enlist assistance and enlist help from other people trying to support research, new studies, all of those things.